Our model looks different than some of the other models that people have seen because we're using the CHIME model, which comes from the University of Pennsylvania. The reason why we use CHIME was because it allowed us to focus specifically on our community and not statewide data. Now, at the same time, we recognize there's variables that come into play that we're now starting to understand, such as the value of social distancing, the potential of heat and humidity as we come into the warming months of summer, the impact that that might have. So we don't necessarily believe or see the numbers coming out like we saw earlier on in the CHIME model, but we do recognize that we are one major event away from having a catastrophic event similar to other cities. And that's why it's important for us to stay on track with social distancing and all the other CDC guidelines that are out there. What CHIME illustrated was how bad it could get in one of those high peak environments, and that's what we're trying to avoid. Well, we hope that the peak doesn't go on into the summer. We hope that it comes sooner. But what we recognize is as we follow the social distancing guidelines, as we look at the CDC recommendations, if we stretch out the peak, what we're really doing is flattening the curve. You've heard that term. If we flatten the curve, what that really represents to us is a lower number of patients at the peak period, which makes it more manageable for all of us. The more we can manage the peak period, the better care we can provide to our patients. The issue of PPE is a complicated one. There are two aspects. One is there's a shortage of supplies. As we have in the past received supplies from other countries, those are not available or not as available. The other part is, you remember, we have to treat every potential COVID patient, every patient under investigation, as if that patient is a COVID patient, which burns up a lot of PPE. That's the reason why people talk about the importance of testing and timeliness of testing. So recognizing that a peak may come, we want to preserve what PPE we have. We want to make sure we have the right equipment, the best equipment, the N95s and the surgical masks for people who are immediately engaging. And then we're using other PPE products, cloth masks, to serve as a prevention for the rest of our staff and the rest of our community. The issue of emergent, urgent, and chronic care is also at hand. What we find is that in an environment like we have today, people are afraid to come to hospitals for fear of being exposed to COVID. Actually, we've set up measures well in advance, going back weeks and weeks, to start separating out symptomatic patients, people who have symptoms, away from our emergency rooms, away from our urgent care centers, away from the doctor's offices. So we separate those out to create a safer environment for all the other patients in the hospital. So that is one thing. But we need to all recognize that without addressing the urgent care, emergent care, and chronic care issues, if you don't treat those things, what you're doing is potentially putting you or anyone else who you know at a risk of having higher complications, even into people who are dying because they're not seeking the appropriate level of care when they should. So that's why you should always seek care appropriately and timely. We certainly recognize that a part of the healing process is having your loved ones, whether that's family members or friends, engaged in your care. This is a very difficult time. It's unusual because to protect our patients, we're having to create a level of separation that we haven't had before. We understand the importance in this environment to keep everyone as informed as we possibly can. So we are taking every measure to make sure that our staff, our team, our colleagues are contacting family members on a routine basis to provide appropriate updates. At the same time, we strongly encourage people to communicate the best they possibly can. Fortunately, we have technologies that help that we haven't had in the past. FaceTiming, Zoom, all of those are out there for us to use and can be very effective tools. And we can use those not only with our family members nearby in town, but we can actually engage people who are across the country. So if you got family members in Seattle or Timbuktu, you can have them contact a patient here and keep in touch.